Welcome to Texas 2036's virtual series, Straight Talk Texas, where you have a front row seat to conversations on topics important to our future. My name is Enisha Shropshire, Director of Board and External Affairs here at Texas 2036. Many of our higher education institutions have an infrastructure in place to help the state address a global pandemic, whether it's COVID-19 or otherwise. By way of example, UT system has the clinical perspective, research capabilities, lab capacity, etc., that the state is currently leveraging to address COVID. Today, Texas 2036 President and CEO Margaret Spellings is joined by Dr. David Lakey, Vice Chancellor for Health Affairs and Chief Medical Officer for the University of Texas System. Margaret?
Thank you, Enisha, and welcome, David. What a odd time, interesting time. You have been preparing for this moment your entire professional career, and thank you for your service to the university and to the state of Texas. We are really thrilled that you're here. I'm going to start where Enisha left off, and that is that I think when people drive by a hospital that says UT something or other or UNC something or other, they get that obviously as part of our health infrastructure, but they often are not aware of all of the rest of the capacities that higher education institutions have in public health and the like. Why don't you talk about how we are leveraging those assets all together now in this moment?
Absolutely, and again, thank you for the opportunity to be here. Many years ago, I had the privilege of running the state health department and came to the realization that if you really want to improve health in Texas, you really need to partner with the academic institutions because state agencies can't really solve the issues. They have limited number of physicians, clinical capacity, and to really move forward, you have to partner with the academic institutions. That's where a lot of the resources of the state of Texas are. And so an event like this, I think, puts a spotlight on those resources and how you can leverage them and use them to really help the state. And so let me give you a couple of examples.
Please.
So you started off with clinical care, and there is a significant clinical enterprise under the University of Texas that is being leveraged right now. We have cancer centers such as MD Anderson that are protecting their patients with cancer during COVID. You have universities like UT Southwestern or UTMB that, again, are providing a lot of clinical care and very high level clinical care, including doing clinical trials on patients, trying out the new medicines. There's been some good news related to clinical trials with a medicine called remdesivir. And so those type of clinical trials occur at our academic health science institutions. And so there's also the testing capacity. The laboratories many laboratories are shut down right now to protect individuals, but other laboratories are doing both research to try to figure out how do we conquer this virus, but also transitioning to doing some clinical laboratory services. And so UTMB, UT down in Galveston, UT Southwestern, MD Anderson, in San Antonio, the variety of our universities are doing a substantial component of the testing for this COVID-19 virus in their communities, serving their communities. Then I think the third prong has to do with education. Again, it's educating the people that are going to be in our seats in the future,
Right.
Educating the physicians, the medical students, the nurses, the social workers, the mental health specialists on how do you respond, and building that workforce capacity and supporting the rest of the state throughout this event. And so there's multiple components. And again, I think part of that is having those academic institutions really having that state-of-the-art, cutting-edge capacity and figuring out and tackling those tough questions of what really is working, what may be hearsay, what is the standard of practice. The other thing that I see is the physicians, the researchers there are being leveraged across the state to bring their expertise to the variety of discussions. And so when I work with the Texas Medical Association or the Texas Hospital Association, and we're trying to figure out how do we confront this, many of the people that get pulled are these experts that are embedded in our academic institutions to guide those policy decisions here in Texas.
Well, and we think, we the public think that all of these healthcare heroes are doing tremendous service to our state. Talk a little bit about coordination, not just within the UT system, but across our other medical systems like Texas Tech or our private systems and the like. How much, common learning or sharing of information are we seeing in this urgency?
Well, one of the my mottos when I was at the Department of State Health Services was the time to exchange your business card is not at the scene of the disaster. You have to build those relationships, those personal relationships with people between institutions before the crisis hits. And that's part of what we've been trying to do over the last several years. We have something called the Texas Health Improvement Network. We have a variety of academic institutions meeting on a regular basis with state agencies to talk about how do we work together in the midst of these type of events. I have a lot of conversations with colleagues, friends from Texas A&M, Texas Tech, Baylor College of Medicine, as we're all trying to figure out how do we work forward in an event like this. We have a group that we've put together that's been meeting for the last 2 months with the Texas Medical Association every Saturday for about 2 hours, where we have individuals, again, from UT, A&M, Texas Tech, with state agencies, with the commissioner of DSHS, with the major health industry associations, so Texas Hospital Association, Texas Nursing, the home care industry, the nursing home associations, and having those tough conversations of how do we manage in the shortage of personal protective equipment? How do we manage to get people tested? What are the policies? And so, again, I think that's, again, part of the advantage of our academic institutions is that they can be that glue and that coordination to pull these different entities together and have evidence-based, science-based conversations to look soberly at the data and say, this is how we need to work together in this event.
Well, I want to get you to answer a couple of questions. One is, here we are in this tyranny of the urgent. What are we learning now? What do we, talk about testing and all of that? But I saw recently, this is a sprint and a marathon.
Yeah.
And so you have started to look at, and I know have been proffering some scholarship around what the coming days hold. What is the trajectory going to look like? Are we going to have big waves or little waves or peaks and valleys and whatnot? So talk about the here and now, and then talk about what we might be looking ahead toward.
Yeah, I think in these first months, our biggest decisions and questions is, when is this going to hit Texas, and how big is that first wave is going to be, and is there enough capacity in the ICUs, the ventilators, et cetera. And actually, we're in a pretty good position right now related to this part of the wave. And I say that because if you look at, the number of deaths, and each of these deaths is obviously tragic, but Texas has just a little over 1% of the deaths. We have about 9% of the population of the United States.
Right.
And so those initial models have been helpful to figure out this first phase of this response. But history tells us that this isn't a short event. And again, there isn't an evidence-based plan you can pull off the shelf and say, this is how it's going to play out. I've been in too many of these to not understand that you have to have a big dose of humility when you're confronting these type of events. And so what does history tell us about novel viruses and how rapidly do they disperse? And there's a nice article by Mike Osterholm and others from the University of Minnesota and related to mapping that out. What are the different scenarios that could occur? And so history tells us there's really kind of three scenarios. And those scenarios are based on how the virus reacts. And so that this virus isn't going to go away until probably about 60 to 70% of the population is now immune, either through natural disease or through a vaccine. It also looks like it spreads more easily than flu does. And so you're going to have to, again, get to those levels. And so the three scenarios are: one, kind of a series of peaks and waves over the next year and a half. The second scenario is we get through this wave, and then come fall, there's a big wave that occurs. And we need to be prepared for that. That would be a big event, but we can't plan on optimism. We need to have a sober look at what could occur. The third scenario, which is what we're trying hopefully to get, is you have this wave, and then you have kind of they term it slow burn, where you have some ongoing but manageable amount of disease, that the hospital capacity, the medical capacity is there. We're tracking down individuals, and most importantly, we're protecting our vulnerable individuals, people that are 65 and above, especially 80 and above, and people that are immunocompromised, and protect nursing homes during this time period. And so I think, I think we have to be careful right now. There is this sense of things are opening up. Is this over? Let's go out and celebrate. I think this is going to be a long-term event. And as I've described it to some of my colleagues, I use the Winston Churchill quote, is now is not the end. It's not even the beginning of the end, but perhaps it's the end of the beginning. Okay. That again, this is a long-term event that we're in.
Yeah. You mentioned you've been involved in too many of these. One of those, these is Ebola. What is applicable from your experience with Ebola that we're applying now?
Well, I've been in several of these, Ebola, H1N1, and a variety of these type of events. I think one of the challenges and lessons is to manage expectations. Mm-hmm. What is really going to happen? Have trusted communicators to say, this is what the science says is going to happen. And people are adults, and treat them like adults and give them the best information you can. Do it in a transparent way. Say, if you don't know something, say you don't know it, but have that conversation that takes place. I think one of the other lessons from Ebola, one of our challenges in Ebola was everyone became afraid of a certain hospital. And so people that were having heart attacks or having strokes.
Babies, yeah.
Yeah, or they didn't go to the hospital anymore because they were afraid of the system, and you had other complications of that. And so we need to make sure that we manage the fear, make sure that ongoing healthcare needs are addressed. I would also say that one of the lessons is for the first responders is, this isn't a short-term event, and they need to take care of themselves. And what I mean here is they can't go 24/7 for months on a time. They need to take care of themselves, have some downtime, take care of their own mental health, take care of their families in the midst of this. And I think that's important. And then, one of my other lessons, I noted it earlier, I think when you're confronting a new virus and a new event, they don't play by the rules. And so you need to have contingency plans. We do a lot of planning, but none of these events go per plan. And you have to have the humility and flexibility to change here and there. An example was with H1N1. We had a great plan as a nation. It was going to occur in China first, and in Asia. We would have all this information and be able to know exactly how to respond and have a vaccine that's ready. And it played out that I got an email on my computer, or somebody's sick in a certain part of Texas, and all of a sudden you're on the front lines of the response.
Exactly.
So you just need to have that humility and flexibility and manage those expectations. And I guess along those lines with managing expectations, that's going to be an issue when a vaccine becomes available. How long is it going to be, and how long before there's a vaccine before it's readily available to individuals here in Texas?
Yeah. You all have been a tremendous partner with Texas 2036 with this eye toward long-term planning and building out access and affordability and public health and population health, those various objectives that we share. As you think about heading into a legislative session, what is your advice for policymakers? What should we be doing now, first, not now, we know what we're doing now. What should we be doing first? And I was on a call recently that said that public health folks think too small, unlike the financial types that are, think in the trillions. I guess we're used to thinking in modest ways, but what's your advice to the legislature? What do we need to do first to make sure that we'll get to the other side of this ready for whatever comes next?
Well, I think some of my advice to the legislature is, sometimes those core public health programs aren't totally understood.
Yep.
And sometimes they become vulnerable, but they're really, really important.
Yep.
And you leverage a variety of those programs that are in the state agencies to be able to respond to this event, such as the Laboratory Response Network that is there within the Department of State Health Services. It is there to be able to identify the first early cases for an event like this. And so in a very tight budget, everything becomes vulnerable, and it's easy to say we're through this and et cetera, but you got to think long-term, and long-term protection of the health in Texas is, I think, one of the parts is having a strong health department, a strong safety net there for the people that are vulnerable. It's easy sometimes for us not to understand the disparities that occur with a disease like this. I think COVID is shining a light on that there are a lot of people that are going to have a really tough time. And don't forget the face of people as we're trying to address the financial issues. And an investment in public health, one of the criticisms sometimes of public health is when nothing happens, they're forgotten. But in some ways, that's a success for public health. And so you got to invest in those core things that provide for the common defense of people here in Texas and the United States.
Yeah, another issue you've been so active in, and as you say, things are at risk, is tobacco use and vaping and things like that if we address them early are pay big dividends in the health of our people over time. Talk a little bit about that and how we can make the case for that value proposition.
Yeah, so tobacco kills about 28,000 Texans each year. And it is by far the largest preventable cause of death in the state of Texas. And a lot of people that smoke when they were kids, they really don't want to anymore. And they see how it's compromising their health, their ability to breathe, exercise.
Like now.
Yeah, right now with COVID.
Yeah.
But it's hard to stop. And so, again, I try to prevent disease, not just get better at treating disease. I think we need to do a better job at helping people keep themselves healthy and preventing their addiction to tobacco. Mm-hmm. And so one of the things that we're involved in is been working with college campuses. We've been working with UT System with MD Anderson for about 5 years now. And part of the first part of it was to make sure we had our own house in order. And so we brought together all the UT institutions, and at that time, not all of them were tobacco free. Mm-hmm. And I think that's really important because if you go to campus as an 18-year-old and there's people smoking there and it's common, you're more likely to smoke and then get addicted and can't stop, especially in that stressful time period. And so our first step was to get our house in order, and there were 3 of our 14 institutions that needed to go tobacco free, and they did it. And by 2017, all of our institutions were tobacco free. So then what we did was, again, I believe in peer-to-peer learning and bringing colleagues together and learning from each other. And so we, again, every year brought together their peers from across the UT institutions and then other institutions. And now our annual summit has Texas Tech in it, has TCU in it, has now this year Texas A&M in it. And we look at cessation and how can we be better as a university in making sure cessation services are available to our faculty, staff, and students. How do we make sure we don't want the police to become tobacco police, but how do you enforce policies like this in a way that's non-confrontational, but in a way to really drive an improvement? How do we look at research in our institutions? And how do we help institutions that want to put in place these tobacco, and I would say nicotine policies? How do we put them in place? Because one of the things that we hear is tobacco may be going down. It may not be so cool to smoke a cigarette anymore, but a lot of people are vaping, and that has its own health consequences. And we need to make sure the right policies and they're in place and that they're enforced in the right way, and that we learn from each other. What are you seeing that's coming, and will be the next problem, and how do we work together? Again, I'm a big believer in collaboration and getting people together to try to address these issues.
Thank you. Well, I think this situation has taught us all that public health and sound education is really everybody's interest, that we are not disconnected from each other as we might have thought. And we are tremendously grateful to you for your service to the state, for all you're doing on the front lines. And we are thankful to have you as a partner on our ongoing work at Texas 2036. So Anisha, I will turn back to you. We could certainly go on and on for another 20 plus minutes, but thank you for your time today, David.
Thank you.
Thank you all for watching Straight Talk Texas. If you have questions and feedback, we want to hear from you. Email us at straighttalk@texas2036.org and follow us on social media and sign up to receive our emails. Visit texas2036.org for more information. Until next time, wishing you and your family well.